Good afternoon, everyone. Thank you for joining us at this town meeting. I'm Kim Goff-Crews, Secretary and Vice President for University Life. Before I turn things over to President Salovey, I want to take a moment to talk to you a little bit about the meeting format. We solicited questions in advance and we received hundreds. So we've grouped the questions into a series of themes, and the presentation will address many of those themes. We do know, however, that the presentation itself may suggest that you have other questions. And we ask that you, if you do, that you fill out the form on the webpage that allowed you to get into this broadcast so that we can track them. If we have time, we'll answer some of the questions live, but we will keep all the questions and make sure that they go to the correct university leader. Now, after today, the covid19.yale.edu and Yale Today will continue to be good sources of information, so please check them often. And one final note, this meeting is being recorded because we want to make sure that if people are not available to see it, that they have an opportunity to do so. And with that, I'm going to turn everything over to President Salovey. Peter?
Well, thank you, Kim, and good afternoon, everyone. I'm very grateful to be able to connect with all of you during this unsettling time in New Haven, across the United States, really around the globe. We've been seeing a global disruption at a scale that hasn't been experienced in generations. In recent months, we've had to alter our lives dramatically to contain the spread of COVID-19. I know that many of you have been confronting the reality that intermediate and long-term plans have been upended. You've made sacrifices, you've experienced disappointments. Some of you have family members and friends who are out of work and who are worried about supporting their families. And of course, some of you are caring for someone who is sick, or you may be sick yourselves. I've lost someone in my extended family, and to those of you who have also lost loved ones, I'm deeply, deeply sorry. Today, though, I believe it is also important to express my gratitude for the way our community has come together to overcome challenges, to take care of one another, to take care of our world. To the Yale community, I'm thankful for your optimism, for your resilience, for your selflessness. Thank you for working hard to maintain the core functions of our university, especially during these challenging times. Our staff, whether on campus or working remotely, have really kept this place going. Our faculty, through their willingness to teach in new ways, has ensured that we continue to educate students and create knowledge. And our students have worked hard to continue their learning online. To those of you who are healthcare workers, you're our heroes. And I'm grateful to colleagues across Yale who are coordinating with the city of New Haven and with the state of Connecticut as well. Working collaboratively with people across our city and across our state, we can support one another. We can share research findings. We can share best practices. We can share strategic planning. I believe we'll get through this. We'll get through this especially if we remain a unified Yale. In this period of uncertainty, I know that everyone wants as much clarity as possible about what Yale will do in the weeks and in the months ahead. For the next hour, my colleagues and I will address your most pressing questions, and they fall into three themes: the health and safety of our community, preparing for financial challenges, and preparing for getting the campus up and running. We'll then answer some of the questions you submitted during the meeting. I have to say, though, much of what we're going to talk about reflects planning that is still in progress. So you have to think of this as a progress report. Okay, one of the most commonly asked questions is some version of how is the university making decisions? And I want to share with you some of the key principles that we use to plan and to take action. First, we will act to protect the health and safety of Yale faculty, staff, students, and neighbors. This is a first principle. All of our actions so far reflect the fact that we view this as a public health crisis first. Decisions about health and safety made by the university in the context of COVID-19 will be evidence-based, data-driven to the extent possible. To me, this is what universities must do. We need to model what it means to rely on experts, on data, and on analysis to decide among options. This really isn't a moment for gut feelings. Our decisions should sustain and advance whenever possible the quality of teaching and research at Yale. We need to preserve our core mission, our missions that have engaged this university for 319 years. We must take the long view in how we think about our human and our financial resources. And I want to be clear, we will be educating our students in the fall. We don't know yet in what manner, but we will be teaching and creating new knowledge. The diversity and excellence of our student body is of fundamental importance, and we won't compromise the ability to educate students regardless of family background. And this means we need to protect the financial support that we provide to students, especially those from the least affluent families. Finally, the university-wide priorities that I've been talking about for the past few years have not changed. And decision-making will continue to reflect those priorities. Now what I'd like to do is move to another frequently asked question. Many of you inquired about the status of COVID-19 in New Haven and what Yale is doing to combat it. So Nancy Brown is the Jean and David Wallace Dean of the Yale School of Medicine, and she's here with us. So Nancy, how is Yale Medicine, the Yale Medical School, and our partners at Yale New Haven Hospital prepared to face down this virus? Can you tell us a little bit about their preparations and the current situation, the outlook for the virus in New Haven and in the state of Connecticut? And what's it going to take? What's it going to take from a medical and public health point of view to resume activities on our campus? Nancy?
Thank you, Peter. Let me start by framing where we are and from whence we've come. It's hard to believe, but the first case of COVID was diagnosed in Connecticut on March 7th. And on the left, you can see the trend in positive cases on the top and in the number of deaths per day on the bottom in Connecticut. On the right, you see the number of COVID-19 patients hospitalized in our own Yale New Haven hospitals. And as you can see, we are seeing a downturn as well, but that at our peak, we had as many as 450 patients in Yale New Haven Hospital, with approximately 70 of those patients on ventilators. Next slide. There's been much work at Yale Health, Yale Medicine, and Yale New Haven Health System leading up to the first case of COVID and continuing to make sure that we could care for our patients safely. This included an early focus on testing, and Marie Landry, shown here, developed the first approved viral test in Connecticut and the first test at an academic medical center anywhere. Yale Health prepared space for patients, and physicians such as Jonathan Siner stood up 3 floors of the Smilo Cancer Center as new intensive care space for our COVID-positive patients. And we reduced the number of elective surgeries and outpatient visits to make room for these patients. We also innovated to make sure that we have adequate personal protective equipment and ventilators. Next. Early on, we realized that we needed to coordinate our research and our clinical responses to fight COVID across the School of Medicine, the hospital, and the university. And so we created the COVID-19 Coordination Response Team, or CORRECT. And here I must give credit to Ruth Montgomery for the naming. And today this includes members of the FAS, the Schools of Engineering, Medicine, Nursing, Public Health, as well as the Yale New Haven Health System. We created a web presence that could serve as a repository for research protocols and preprints so that our investigators and clinicians could see data as soon as it became available. And investigators at Yale have been involved in discovery science, understanding the mechanism of infection, and importantly, the host response, as well as in vaccine development, therapeutic trials, and seminal epidemiologic studies. This webpage also provides continually updated clinical protocols. And these clinical protocols have been informed by conversations with colleagues in China, Italy, Washington, and New York, and by our own evolving experience as we learn about COVID-19. Next slide. We know that the effects of COVID-19 are more severe in older patients, as well as those who have obesity or diabetes and hypertension. But we have also learned that the severity of COVID-19 is greater in patients of African or Hispanic descent. We've leveraged a wonderful group called the Cultural Ambassadors. These are ministers from the Connecticut AME Church and members of Junta for Progressive Action who have been advocates for many years for clinical research to get the word out about the ways in which we might limit COVID infections and how patients can see. We also understand that social distancing and all the measures we have taken to flatten the curve have significant effects on the economy and therefore the long-term health of our community. And Yale economists and social scientists have been advising local, state, and national government on ways to reduce the impact. A group of faculty from the schools of public health, nursing, medicine, and management, as well as Yale Health, have been meeting daily to address the conditions necessary for reopening. One member of this group, Albert Coe, is a member of the governor's task force on reopening. Much has been written about the conditions that are requisite, and this chart on the left is one that I find very simple but useful from Resolve to Save Lives. And I think what you can see from the graphs that I showed at the beginning, that we are starting to meet many of the conditions, such as the decline in the number of cases and deaths in Connecticut. And we've also done a lot to ensure that we have adequate personal protective equipment. Many think tanks have issued reports, and we will use these as well as our own expertise on campus to guide our plans for reopening in the context of both national and state guidance. Peter, thank you.
I wrote to the Yale community about the two big issues facing us beyond the immediate health crisis. How is COVID-19 affecting Yale financially? And what are we planning to do in the fall? Provost Scott Strobel is leading the effort on both of these fronts. And so why don't we turn to him? Scott, why don't we start with finances?
Thanks, Peter. It's a pleasure to talk to you today about those questions. Like many of you, my household has been impacted by this. A few months ago, as my wife and I alone in our home, we now have 8 people living here as my 2 adult children and their spouses and their 2 children now live with us, including a 3-year-old granddaughter. Turns out Nora is looking for distraction. And one of the things she likes to do is we every now and then go for a drive to just get out of the house for a few minutes. As we come to the driveway, she begs from her car seat that she might have the opportunity to steer into the driveway. So before you call DCF, this is just a few dozen feet before we reach the driveway, and she needs to make a right-hand turn. What we've realized as she's done this is she fails to recognize that as we approach that turn, she needs to begin turning the wheel. Instead, she assumes that she can begin the turn as the corner is reached, rather than turning it in advance. In some sense, this is a allegory of what it is that we're headed for and what we're trying to manage as we consider the financial implications that are now faced by the university. We do not yet know the full magnitude of the turn that we need to make, but we do know that we need to start making that turn. Anybody who's looked at the headlines in the past few weeks recognizes that this pandemic is causing huge economic impact. Entire economies of the world are in lockdown. Unemployment rates have now hit 30 million in the United States alone, which is an unemployment rate approaching 20%, which is the highest level since 1934 at the heart of the Depression. Financial markets have fallen steeply, and while they have recovered partially, they are still highly volatile and clearly unknown for future days, weeks, and months. The gross domestic product, which is the broadest measure of goods and services in the country, fell by almost 5% in the first quarter, which was not a full COVID quarter, and is likely to follow still substantially more in the coming quarter. But what does all this mean for Yale? What is the magnitude of the curve that we need to make? What is this turn we need to begin to make and begin to follow? Those are the questions that, of course, we need to consider. And as I answer that question, I would like to consider them in sort of three phases. The first phase being effectively this year, this financial year between, which is fiscal year 20, which began last July and continues through June of this year. Then there's the medium term, which is effectively what happens next year. And then the longer term, which is what happens over the next 1 to 5 years. As you know, Yale has four main sources of funding. These include tuition, fundraising, the generosity of our donors, returns on the endowment, and clinical medical services. Those are the main ways that we receive revenue and use that revenue to pay the various expenses that run the university. Over the past few months, just the months of March and April, the unexpected, unanticipated impact of COVID-19 on our budget is approximately $200 million. This is in the form of both reduced income and new COVID-specific costs. This includes the refund that we made to the room and board for students in our housing. It includes the reduced clinical revenue as a result of performing fewer elective procedures in our hospital. It includes fewer gifts from our generous donors. It includes the reduction in sponsored awards from the research that's underway in our laboratories. We put up a field hospital that had a cost. We lost revenue as a result of the summer programs that we normally have for students that visit Yale during the summer months. As a result, we see a substantial reduction in our revenue that of course hits directly to our bottom line. The good news is the university has sufficient reserves that we can manage this one-time shock. We budget conservatively and we act prudently. And so if this was a one-time impact, we would be able to not easily, but we would be able to manage the beginning of this turn. But we anticipate that this is just the beginning of the turn. There are other high levels of uncertainty. Let me give you just a few examples. As we begin consideration of the FY21, the fiscal year 21 budget, which is next year's financial budget, we can already see that there will be greater need for financial aid for our students. There's a significant level of tuition uncertainty, particularly for students that are from international locations that may not be able to get to campus, not because of a lack of interest or a lack of desire on our part, but challenges with their visa status and being able to get the visas that they need, the paperwork that they need to be able to come to the country. It will have impact on the endowment that is still yet to be understood in relation to the markets. And it's also possible that this will continue to impact the gifts that we receive from our donors. Because the magnitude of the turn is unknown and will not be known for several months or even a couple of years, we have begun to make the turn without fully knowing its magnitude. And to begin that turn, we have announced several actions for the coming year, and these were announcements that were made just over a week and a half ago. It included a 5% reduction in spending. This is a reduction in the general account spending that is used to fund programs across the university. And this 5% reduction will largely be achieved through other things that we announced at that same time. Namely, a pause in hiring through next year with few exceptions that are permitted or allowed with appeal of the Provost or the Dean of Medicine, a salary freeze for the coming year, reduced spending on building projects in which we removed $300 million of capital spending from projects over the next 2 years, as well as a reduction in travel and other discretionary spending for the coming year. So that identifies the actions that we are going to take for the coming year. But then the question is, what happens in that period and beyond? What happens over that period of 1 to 5 years? And that is the area in which there is still a high uncertainty. How steep is the economic downturn? How fast or slow will the recovery be? And will that recovery be a U shape or a V shape or a W shape? The answers to those kinds of questions will obviously directly impact our ability to handle this financial storm. How long does the pandemic last? And how quickly is a treatment or a vaccine identified? Because first and foremost, this is a public safety issue, a public health issue, with consideration as a priority given to our faculty, staff, and students. And so we are trying to manage this first and foremost with the community's health and well-being in mind. How large is the impact on the endowment, which fundamentally is at the core of what we can afford given the large fraction of our budget that it provides? And how does that impact get incorporated into the budget over time? That is a question that we are still seeking to understand. The question that is most often asked of me and probably most often asked by many of us is, why is it that we can't just spend more of the endowment to cover the financial shortfall we have experienced or may experience in the coming years? Why can't we change the spending rule so that we can cover anything that might be needed, utilizing the large size of the endowment to do so? I think that's an interesting question, and it's an important question. It's a question that requires an answer that appreciates the long-term priority that the endowment provides, the long-time support that the endowment provides to the university. And so I turn it back to you, Peter, somebody who was a provost for many years and has been president for still several more, to help us understand the importance of the endowment in managing our budgets and finances.
Great, thank you, Scott, and thank you for that discussion of our budget. So the question is, why can't we spend more from the endowment? It is true, I'm asked that question a lot. It's very important to recognize that the endowment is not a budget surplus. It's not a rainy day fund. What the endowment is a collection of gifts given to the university by generous donors, mostly alumni, over the course of the university's history. And these gifts are restricted by the donors in how they can be used. For example, there are gifts for financial aid. There are gifts for professorships. There are gifts for student activities. These gifts are invested and they grow over time, based on a policy that ensures that future generations have the same financial resources that we do now, not more, not less, the same financial resources that we do now. We spend a certain amount from the endowment every year. It's about 5.25% of the value of the endowment. That's actually a lot of money. This year, that's about $1.4 billion. It's more than a third of our operating budget of the entire university. And if we were to leave out the medical school, it's more than half of the operating budget for the rest of the university. So to do this year after year, the endowment must grow. Enough to make up what we spend for it. Enough to make up what we spend from it, plus inflation. So the endowment has to grow on average the amount we spend plus inflation. So I asked the investments office to give me an estimate of what will happen to the endowment this year, next year, and the following years. And they are expecting the following. They are expecting a recession for some time and eventually a recovery. And when we look at the amount of the endowment we can spend based on their predictions, we can compare it to the amount we thought we could spend before the COVID-19 pandemic. And there's a difference. A few years from now, we could have $300 to $400 million per year less to spend than we had originally anticipated. And that's why we're taking the actions that we're taking now to blunt the impact of this anticipated drop in funds, as Scott described. This is the turn that we are anticipating well in advance of making it. And so it's the budgetary framework within which we're working. We'll keep the community updated as the financial picture becomes clearer and clearer. Let's turn though now to questions about the future, including the fall semester. Scott, I'd like to ask you to frame that issue as well.
Sure, thanks. So as the community knows, I started as provost on January 1st, 2020. This was not particularly good timing on my part. I had been in the job just over 2 months when the pandemic hit. I think I, at that point, had figured out where my office was and had managed to bring in some of my books. But here we are. So in the course of the first 100 days in the job, and I should say that I've at least been in the job longer than Nancy has. She started on February 1st. So we have learned on, we have done a lot of on-the-job training. During the first 100 days in this role, we have moved classes online. That was an announcement on March 10th. Of course, these are all announcements that you and the community have received. We asked the community to work from home on March 16th. We stopped non-essential research in laboratories and libraries. We postponed commencement and reunions. We canceled summer events and travel and extended the work from home policy through the end of May, just over a week ago. The second half of spring semester 2020 will be memorable to all of us. It was the semester that we converted from a residential university to doing online education. It was not perfect, but I think it worked better than many of us expected. We demonstrated how resilient this community is. And overall, I think it was an impressive effort. I would specifically want to thank the faculty and graduate students for their hard work in delivering their courses in a format that none of us imagined or even contemplated as the semester began. As I mentioned, I'm sure that I am probably not the only one who is managing the demands of a child in a house as you consider how you have juggled the various pressures on your time over this past several weeks. I want to thank you. I want to thank the faculty, the staff, and the students for their patience in a learning environment that is very different than what they imagined when we started. Work has changed, teaching has changed. Critical research has continued. That includes research that's going on still in our laboratories focused on COVID-19, some of which Nancy described to you. Research to expand testing, to engineer increased ventilator capacity, to do clinical studies on drug treatments that will lessen the symptoms of this disease, and of course, the frontline doctors, nurses, and patient-facing staff who are heroes in this pandemic. The question all of us want to know is what happens next? The way I phrase it is, what will I do on my second 100 days in the job? When will laboratories be reactivated for non-COVID research? When will the library be open again so that we can do work in the social sciences and humanities? When will we be able to go back to work? Will the university be open in the fall semester? Will we be online or will we welcome students back to the campus? These continue to be difficult questions and we do not yet have final answers. But we are taking each of them systematically, carefully, expeditiously with input from across the campus to understand what the answers to those questions should be. Last week, President Salovey announced a process for addressing these important questions that employs 6 faculty committees seeking input from over 65 different faculty and additional senior administrators who have experience from across the university. They will in turn, or are in turn, still seeking further consultation from faculty, students, and staff to identify what the answers to these questions should be. Let me briefly introduce you to those committees, the work that they're doing, and the way they're approaching their mandate. First and foremost, we want to follow the public health advice. And so the first committee is a public health advisory committee that provides guidance for the protocols and procedures and directions we will follow as we consider any other action that the university will take. The second is the research continuity group, recognizing that it will be possible to reactivate our laboratories and our libraries before it will be possible to reactivate the work that goes on in our classrooms and dining halls. This group is defining how to do safe in the labs, in the libraries with clear protocols and standards. There is also an academic continuity continuity group that is chaired by Pericles Lewis. Pericles will be talking to us about the details of his work in a minute, but I want to identify what that group was charged to do. One of the challenges that I have in thinking about the decision-making process in this is that it all becomes a question of probabilities of certain things falling into line. Will there be sufficient testing? Will there be sufficient PPE? And so to pull apart that probability question and make it possible to just think clearly about the possibilities in front of us, we have asked one of the subcommittees under academic continuity to think about the question, what is the best version of an online education that we can provide, recognizing that we now have several months to prepare for it if that's what we end up needing to do in the fall. So that's the thinking of one group. There is also a second group that is thinking about the question, what is the best version of a safe residential in-person education that we can provide in the fall, recognizing that we will be under constraints for public health considerations. Those two considerations, those two groups, thinking in parallel with each other, we think will be able to identify the best possible version of what eventually becomes our decision for the fall semester. There's also a group considering what are we doing in the creative practice, specifically around the arts. For example, this represents particularly new and different questions, different than what's being considered in the other two groups. How do you socially distance a play, or how do you socially distance an orchestra? So what it means to bring the arts groups, reactivate the arts groups is an important question. All of this will be informed by a group that's thinking about operations. How do we reimagine work? How do we reimagine teaching and research? And this group has considerations from human resources, facilities, IT, and hospitality. Of course, we need to make an answer soon, and the sooner we can make an answer, the better it will be for our community as you plan for what will happen in coming days, weeks, and months. We are committed to giving an answer for what will happen in the fall semester no later than early July. So this will be approximately 2 months from now, as we giving us approximately 2 months to then make final plans for what the fall semester will look like. With those committees at work, I should say that they are working incredibly hard. They have made major time commitments to get this work done. And I am very impressed with the deliberations that they are already making. But of course, we all want to know the answer to the questions that they've been tasked to answer. Peter.
So I think we should turn to Pericles and ask him to tell us a little bit, particularly about the work of his committee and what it is planning with respect to the educational mission of the university.
Thank you, Peter and Scott. Yale, of course, has been educating young people for service for 319 years. The educational mission of the university is paramount, second only to the health and safety of our staff, our faculty, and our students. And we need to be prepared to continue this mission in the fall semester. Like many peer colleges and universities, we're looking at two main scenarios for planning purposes, and we'll probably wind up with a hybrid of the two. If we are unable to come together in person in the fall, we will provide remote or online options. That's, in a sense, scenario one. We realize that this is not ideal. I've been a professor at Yale for 22 years, and I know that nobody comes here in order to take online courses, or you want to be here in order to meet the faculty and interact with your peers. But we know that some students, including some international students, or those with health issues, or those otherwise unable to travel, may not be able to make it to New Haven in time for the start of classes. and there's the risk of a second wave of infection that might delay in-person opening. So we're preparing for the online possibility. Our faculty and staff worked very hard over spring break to get the spring semester courses up and running online in an emergency situation. There were challenges, but as Scott mentioned, I think the outcome was better than many of us had expected. We now have the summer ahead of us to make sure that we provide this form of education even more efficiently and effectively, and this means improvements in technology, course design. So I'm grateful to staff and faculty who are working together to prepare more effective online and remote versions of courses for the fall, should they be necessary. The second option, of course, is to meet in person, and if the public health conditions warrant it, we'll be providing that in-person education, including residential and extracurricular life. At spring break, we had to close down the residential colleges and some other facilities very, very quickly. The reopening is likely to be more gradual, and we'll need time to be prepared for evolving circumstances, and also for any public health conditions such as social distancing and so on that may be necessary, even if we are back here in person together. There's a lot of uncertainty, but our goal has been to make the campus ready for students to return sometime in the fall, as early as possible in the fall. Initially, this may be in smaller groups, and we may have some hybrid of in-person and online teaching. It won't be exactly the same in the graduate and professional schools as it is in the college. We're looking at safe ways of housing students, including providing facilities for quarantine and for self-isolation, enabling contact tracing in case there's a second wave of infection, and of course, being prepared to treat anyone who falls ill. We plan to keep the campus informed as this discussion proceeds, and we'll provide more detail in early summer. I realize that it's frustrating not to be able to give a detailed account of each of these scenarios at the moment, but we've been sort of trying to plan out all the various options and recognizing the complexity of the problem, and we want to present the president and the provost with an adequate map for making this decision. Now, Peter and Scott and I and all of our faculty and staff are committed to Yale's educational mission. It's never been more important than it is now. Yale has been through many crises in its history, and this is, as far as I'm concerned, this is the biggest crisis I've ever seen, and I imagine it's the biggest crisis that many of us have ever encountered. But we're a strong community, and I think we will come through this and ensure that all Yale students get an excellent education in the years to come. So thank you, Peter and Scott.
Great. Thank you very much, Pericles. Kim, I want to throw this back to you. In your role as Vice President for University Life, what concerns have your team been working on and preparing for, especially in this context of so much uncertainty? Kim?
So what I was saying was that one of the things our staff hears a lot about are people feeling a loss of people and place, because we're all scattered all over New Haven, all over the state, many of us, all the country and the world. And we miss, people talk about missing interacting with their colleagues and their classmates, pursuing their work and activities, and actually physically being on campus and in New Haven. And Zoom sometimes just doesn't do it for everybody. I know for me, I miss seeing Trey and Jennifer and Felix and the custodial staff and SSS when they come in. Or like many of you, I'm tired of my own cooking. I wouldn't mind going to a dining hall at the moment, going to Berkeley College, which I go to a lot, and seeing Nanette and having a good meal, or even walking around the grounds the facility so lovingly it prepares around this time of year. So I know most of you are missing being here physically. But we have to sustain a sense of community, and we have a lot of staff who are working very hard to do that. We recognize and hear about challenges, and certainly we've all talked about the fact that people have concerns about childcare, about the internet connections that they have for themselves and their children, and of course the need to support faculty or family members who are sick or who may have lost jobs. So we continue to support them as well. And we're paying particular attention to, in particular, mental health and well-being. We have a lot of colleagues around the university who are working very hard to support the community on that. The Being Well at Yale program, which supports staff and faculty, has been putting a lot of its programs online, and they report that there are increased numbers of people dropping into the meditation sessions and also to stretching exercise classes, which is good to hear. We continue to support students who might have needs for mental health and counseling, and that particular program has been receiving 700 calls with students over every week. So they're being really helpful to make sure the students are dealing with whatever anxiety or other issues they have as they complete their term. Now, we recognize that there are other kinds of challenges that are being exacerbated by this particular health crisis. Dean Brown mentioned one of them. COVID-19 is affecting different populations differently based on race and socioeconomic status, as she mentioned, including here in New Haven. We're conscious of that as it plays out in the community, the campus community as well. And of course, there is news nationally of the rise in racial discrimination around against Asians and Asian Americans. And we want people to know that we have resources available to support people, because we really want to support those who are facing harassment and discrimination. So we have a team of people around the university who are working very hard to make sure that the community is taken care of and that we can connect with each other. I encourage you all of us, to support each other as we go through this process of trying to not only continue to flatten the curve, but also to prepare to turn the corner that both you and Scott have described.
Great, thank you very much, Kim. Kim, Nancy, Scott, Pericles, I want to thank you all for what you're doing for our community. Kim, I'd be interested in hearing some of the questions that you've been collecting from participants. So why don't we turn to those questions now?
Good. So a lot of people that submitted questions, so thank you, everybody. The first question is for Nancy. Nancy, the question you're being asked is, when faculty, students, and staff return to campus, what will we do to reduce the possible transmission of COVID-19 in terms of cleaning, social distancing, PPE, and the like?
Thank you.
That's gonna be your question, yep.
Yeah. So first, I would say we will adhere to current state and city guidelines at the time that we reopen. And these in turn will depend on the prevalence of infection at that time. And so we may need to make changes as the characteristics of the epidemic and that guidance changes. I'd say social distancing is the fundamental strategy, and it's going to include modifying our physical spaces and our movement patterns so that we increase distances in the classrooms and our labs, our offices, the dining halls, our common spaces, and the dorms. Depending on the guidance and prevalence of infection, we may need to require masks, and we may need to limit large gatherings. Our colleagues in environmental health services are already developing plans for enhanced cleaning through the school and the dorms. Yale Health, as you know, offers testing and contact tracing for individuals who develop symptoms. And I think it's going to be very important that we facilitate the ability of our students and our faculty and staff to self-isolate and also to obtain medical care as needed. And of course, we've already developed the systems to do this for our healthcare workers over the last several months.
Great. Thank you, Nancy. We have a lot of questions related to research. So Scott, I'll ask you, when do you think research labs will open, and how can we open them safely?
Yeah, it's a great question. Like most of the people that ask that question, it's a question I'd like to know the answer to, because I, like others, I'm a faculty member who has a research lab whose work was suspended. We had just received a new federal grant to do work that we were excited to perform. But in order to follow public health guidelines, that work has stopped and the lab has been cleared. But of course, we, like others, are anxious to get that work started again. But we need to do it in a safe way. And it's not just work in laboratories, it's also work that's done in libraries with collections and access to the various and amazing resources that are available to the faculty, staff, and students at the university. It's important that we move carefully, safely, and within public health guidelines that Nancy just described, and also in compliance with government policy. I was interested to hear that Governor Lamont emphasized that university research is one of the functions that he would like to see reopen soon, an announcement he made within the past day. We expect we will be able to reactivate research labs and in the libraries before we have students in the classrooms and the dining halls, as I mentioned before. The densities are lower. It's easier to socially distance. It's often the case that personal protective equipment is worn in these spaces, particularly in the laboratories. And so we anticipate that it will be able to, something that we can do before the fall semester and hopefully substantially sooner than that. As I described, there are research continuity committees being chaired by Mike Crair and Susan Gibbons, and their deliberations have gone on for about almost 2 weeks, and we expect the report will be completed and released in the next week or two. They have worked very hard and very effectively. Let's be clear, this will not be an immediate return to work, and the work that we're doing will not look like it did when we were working in those spaces in February. After that report is released, that guidance is released, each research group will need to consider how their operation can be achieved within the safe and operational requirements of the phased reactivation that will be described in this committee report. Each group will need to think through those questions. But let's also be clear, we will reactivate our labs and libraries soon. We will do it safely, and we will follow public health guidance and government recommendations. Yale will return research productivity.
Thank you, Scott. The next set of questions have to do with financial aid. Will financial aid be affected in the fall? And will Yale College financial aid be reevaluated given the economic circumstances? Peter, I think that's for you.
Okay. Thank you for that question about financial aid. Look, the university has taken a substantial financial hit. However, and I want to be crystal clear about this, our commitment to our need-based financial aid policies is unwavering. Now, students in Yale College, if you're watching, if your family circumstances have changed, you should bring that information to the attention of the Office of Undergraduate Financial Aid. They'll be ready to help you.
Great, thank you, Peter. I see we have a lot of questions, very specific questions from students about leave policies, looks like housing, retrieving and storing belongings, left on campus, grading in the fall, and the like. Students, I would say that your deans are all looking at many of these issues, and they will be communicating with you directly in the weeks and months ahead. So look for those emails. We also have a lot of questions about commencement. And I wanna let you know that we are definitely going to be welcoming the class of 2020 back in person to campus. We just don't know exactly when because we have to wait for public health guidelines to tell us when we can invite several thousand people back to be here for traditional Yale ceremonies. But when we know that, we will let you know. And I do want to tell you that we're going to have all the pomp and circumstances that we normally would have as a traditional ceremony. But we're also going to celebrate you twice because we're going to have a special celebration with President Salovey giving you, actually conferring your degrees May 18th. And we'll send you some more information about that as well. So look forward to that. And we will look forward to welcoming you back in person later on. So Peter, I think that might be all the questions I can see.
Okay, thank you, Kim. Appreciate that. And we appreciate those who sent questions. We know there's others that are out there, and we'll try to answer them in other ways. So let me conclude by saying this. At Yale, we're going to continue to pursue our mission. We'll be educating students in the fall. We'll be conducting research more fully as soon as it is safe to do so. Our financial challenges are serious, but with your help and guided by our principals, we can work through them. Someday we'll look back on this period and we'll know that our university emerged from it stronger and more unified. And that research universities like Yale made substantial contributions to addressing this horrible global crisis. I want to thank everyone for what you do and what you will continue to do for our community and for joining this conversation today. We'll keep you updated quite regularly, and we'll do that through email We'll do that through another town hall that we are going to schedule, most likely for July. And we'll speak more at that time about the fall semester. In the meantime, as Kim suggested at the beginning of this, please visit covid19.yale.edu, covid19.yale.edu for the latest information. And to keep up with late breaking news, please look at Yale Today in your morning email. I want to thank everyone for attending this town hall. Thank you for all that you're doing under these challenging circumstances. Thank you so much.